Let me begin the questioning. Let me start off with Mr. Grigorinski, and I don't have a lot of time, so please answer briefly. Mexico is not the most progressive state in the country. It's not the most conservative state in the country. You have kind of revolutionized the way you do child care in that state. How do the people in Mexico feel about it?
Thank you, Chairman Sanders.
Talking to the mic, please.
Thank you. They are thrilled. I traveled the state. I talked to families. I talked to providers. I talked to educators. Everybody feels more valued and respected.
So what the governor has done and what you have done is popular in the state. People feel good about it.
Absolutely.
All right, Ms. Hogan, let me ask you. You're an expert on children in this country. First thought, how do we compare in terms of our child care with other countries? And second of all, in your judgment, given the fact that psychologists tell us 0 through 4 is the most important years of intellectual and emotional development, how do we treat our kids in general?
Thank you for the question. I think it's really important to know that the U.S. does not stack up well compared to what other countries have chosen to do, given, interestingly, research and information that they base on what's happened in the U.S. They know from what we've done the promise that exists in early childhood education and learning, and they've taken that and made the investments that are necessary across childcare, of course, but also paid leave and the other ways in which we're able to invest in the supports for children and families that are needed.
Okay, Ms. Mormon, we've heard a lot of discussion today. You made one simple fact, which I think tells us all as much as we need to know. You mentioned that you are paying workers at your facility, which I gather is not a government-run, one-size-fit-all. It's a little small private operation that you have. What, 11 families, is that right?
Yes, sir.
Okay. You mentioned you pay workers in Virginia $12 an hour.
Yes, sir.
And I know that you do it. That's the best that you can do. You're struggling to stay in existence. I mean, just in general, and I applaud you for maintaining your facility and providing childcare. But would you agree that we have to, as a nation, do better than pay people less than what they make in McDonald's or almost any other profession out there?
Yes, sir, I would. As I mentioned in my testimony, I'm enrolled in the Virginia Child Care Subsidy Program, but I have vacant slots that I cannot fill because I need to hire an additional staff person. I recently interviewed, as I stated, the young lady, and I shared the pay, and she declined. So hiring an additional person would have given us the ability to care for more children and be more flexible with the hours. Currently, as it stands, if either of us, meaning my other staff person, if we are sick or have a family emergency, then I must either close my facility for that time period or reimburse parents for the day if they are unable to find alternate care for the day that was not a scheduled day in advance.
Thank you. Let me get back to Madam Secretary here. What have you been able to do to raise pay in New Mexico and attract more qualified workforce?
Thank you, Chairman. What we've been able to do is we raised everybody's wages $3 an hour who worked in childcare. Providers opted in if they wanted to do that. We've also set our childcare reimbursement rates at the true cost of care using the cost estimation model. Providers are able to attract and pay people now $16 an hour, $17 an hour, and we're valuing and respecting, again, families and educators. And families have more choice. Families now have more choice, both because we have family child care, we have faith-based, we have language immersion programs.
See, the idea of one size fits all is not what you're doing in New Mexico.
No. They're all private businesses, nonprofit, for-profit, faith-based. There's lots of options for families, and it's important that we invest in all of those options.
Ms. Hogan, if in Vermont it costs $15,000 a year, what impact does that have on the financial well-being of families? Can families afford, in many cases, middle-class, working-class families, afford child care?
Vermont's actually doing really great work to address comprehensively early childhood education, but you know, the reality is that families can't, as we know, families cannot afford it. The problem is that policymakers ask parents to cover this cost of care out of their own pockets. And we ask educators to subsidize the cost through their own low wages. And that's because of the way the market is structured, it doesn't work because the benefits go so far beyond each individual and
All
family.
right, let me interrupt you and just ask you my last question here. Why is childcare so expensive?
It's a great question because it's something that every parent with kids in or looking for childcare asks. And the reality is that it does require a little bit of an understanding about the market. It is a labor-intensive market, and it should be. Like, this is about driving safety and consistency and quality. Programs regularly spend up to 85% of costs on personnel to have these in place. But it's important to remember, I think, that the goal is
In other words, you don't have one worker for 30 or 40 kids.
no. And you have to have those in place in order for safety and for driving quality. And we can talk more about some of those pieces.
Okay.